Thank you all for joining us today. I'm Paula Hazen from Arbor Bank, and I am part of our healthcare banking team. Surcharging is a very hot topic, widespread topic right now, not only across the medical and healthcare industry, but across all industries. Surcharging is important to understand the pros and the cons, and if it is right for your practice. I would like to introduce our two wonderful expert presenters today. Mike Cushing, President of Vent. Mike has been in the merchant processing industry for over 18 years. He initially started his career with TSYS, which is one of the largest processors in the country and industry. Before becoming president of Vent, Mike was managing the global strategic partners at PayPal, where we spent 7 years in both sales and operations. Healthcare merchants are a key industry that Mike works with to help streamline processes and create efficiencies with regards to credit card acceptance. Our other presenter today is Lauren Harris with Harris Healthcare Consulting. Lauren is a practice performance strategist with over 30 years of experience improving leadership and operations in medical practices. Since founding her consulting business in 2020, yay COVID, she has helped more than 100 clients nationwide tackle and the challenges and elevate their leadership. A self-described leadership nerd, Lauren is passionate about teaching and mentoring. She combines her own experiences with practical, data-driven strategies that optimize not only financial health, staff engagement, as well as patient experience for long-term success. Just one little housekeeping tip. We are going to be having a Q&A discussion session after the presentation. So if you can hold your questions till then, you can either put them in the chat or unmute yourself and ask yourself. That would be great. And if you can stay muted during the conversation, just so it's easier for the presenters to present. Mike, go ahead and kick us off. Thank you.
Awesome. Thank you, Paula, for that kind introduction. And man, did you guys hear all that stuff that Lauren does? Like, it's unreal. I know most of you have probably worked with her on this call and have had this opportunity, to, like I said, have commerce with her. And she's phenomenal. So, like I said, great to be presenting with you today, Lauren. But I'll jump right in, guys. I always kind of start these presentations with like a third-party story, right? So imagine, if you will, a real busy chiropractic practice down in Phoenix, Arizona, right? They started to implement a surcharging program and to cover the processing fees, right? But within a month, those patient complaints have skyrocketed up 30%. Self-pay patients stopped coming back. Visits decreased by 12%. And the front desk had to spend more than 10 hours a week dealing with billing issues and trying to refund those transactions. Not only did this create negative reviews and a frustrated staff, but it was ultimately a decision to roll back surcharging because it was not beneficial from an inpatient experience, right? So that's a third story party that I like to set the stage with, because as we go through this, like Paula mentioned, we're going to discuss the pros, we're going to discuss the cons, and we're going to discuss what actually your individual practices would need to be aware of in order to start this process of, should we start surcharging or should we stay with our traditional merchant processing programs? So with that, we'll jump right into understanding a few of the surcharging rules and regulations. So the biggest thing that I call out is that there is a tremendous amount of state variability, right? Um, Surcharging is evolving, and I'm not sure if, most of the folks on this call have heard of the CFPB, the Consumer Financial Protection Bureau, but that has played a big role and a big impact into how surcharging is being delegated at the state and local levels. So this isn't a mandatory program across the country, and it's not a one size fits all. There are different things that we're going to need to touch base on for each state, right? Second is that legal compliance, right? Making sure everything that you're doing from a surcharging policy, you're adhering to that local legislation regulation, right? The maximum rate that Visa has is capped at 3%, while MasterCard is 4%. So you can see already right there where it kind of is, it's starting to cause some issues, right? So Visa being capped at 3%, my advice, if you are going to implement a surcharging program, would not be to go above that number, because that's obviously, you can't control what the patients are going to present as a form of payment. So we want to make sure that we never get into hot water by having a 4% surcharge when Visa is only allowing that 3%. The amount of transparency that's required, you have to clearly disclose those surcharges as a separate line item on every bill. If it's not clearly shown, then we're out of compliance again from the rules and regs of Visa and MasterCard. And notifying the patients, right? Informing them, having signage, having all of these different things that show this is going to be implemented during the checkout process is also a big part of staying compliant. And then every credit card provider has different rules, right? Like I was just mentioning. So MasterCard, you'll have to register directly with MasterCard. Visa, you'll have to register directly with Visa to become a surcharging merchant. And then during that process, by way of proxy, Discover and American Express are included into those. So you would have to register with both the big boys, and then Discover and American Express would follow suit. So moving on, let's jump into the pros, right? We'll talk about all the good stuff first. So obviously, surcharging has the tremendous capability to help recover your cost and offset your merchant processing fees. This in turn helps increase the revenue for the practice and allows you to be transparent with your pricing for your patients so that they understand, hey, we are implementing this, and this is something that's going to help us recover our costs for accepting this form of payment. And hopefully, in return, with that increased revenue, cash flow will help improve for the practice. So I would say that those are our main four benefits, or the pros, of being able to surcharge a credit card payment. And, to go a little bit more historical, some of the market observations that we've had in the industry adoption, surcharging has been around for about 16, 17 years, almost as long as I've been in the industry. But about 15 years ago, it was really only B2B merchants that were going to be utilizing this. So think about, for your practices or your clinics, the type of equipment that you have to buy from a large distributor, and it's a, $30,000 piece of equipment, but you wanted to be able to put it on a credit card. Well, that obviously is a much larger transaction than a $40 copay. So with that being said, Visa had created these rules to be able to say, okay, we can pass that cost on to the cardholder if they're willing to accept that cost. When you're thinking about when you're thinking about these services for B2B, knowing that a physician or a private practice is more of a retail environment, you can see the difference for what the optics look like from a consumer standpoint versus a business. All that being said, we are starting to see that the restaurant industry would be the number one vertical that has adopted this surcharging implementation. I live in Nebraska, and we're really good at taxing things here. So we have a restaurant tax. We obviously have our state sales tax. But then on that line item on my receipt, whenever I take my family out to eat, I will notice that there is a surcharge for paying with my credit card. And when I notice that, obviously I have some feelings because I'm in the industry. If I present my debit card, for instance, to be able to pay that bill, most merchants don't realize that you cannot surcharge a debit card. You can only surcharge a credit card. So there's other programs out there that they're trying to get around by skirting this called cash discounting, or a convenience fee program, which has gotten away so far in the restaurant industry. But I don't know if it's going to translate into a retail environment in the healthcare space. So again, retail sectors, if you think about it, when you're doing online shopping, when you're shopping in store, at a TJ Maxx, a Marshalls, a big department store, Dick's Sporting Goods, those big box retailers have not adopted this philosophy yet. But we are starting to see it in some of the smaller ones, maybe a local boutique, that sells certain goods. We are starting to see it there. So if I, can tell you that the industry is adopting this, yes, they are, but it's still a slower adoption than most other Visa products, MasterCard products that are out in the marketplace. So I think right now is a really good time to pause. And Paula, I believe we've got a poll question for everybody, correct?
We do. Before we go to the poll question, we do have a chat question. Do we need to worry
Okay.
about how much we charge? Are there rules in Oregon about this? And then there's another question. So if you want to answer that first, then we'll go into the second part.
Sure, sure. So let me make sure, let me see. I apologize, guys, as the host. I haven't been able to see the chat, so let me just see if I can pop back in here really quick. Okay, so there it is. Do we need to worry about how much we charge? Are there rules in Oregon about this? Since there is a cost to deposit cash in the bank as well, why would we target credit cards to cover their fees? What about just a billing fee for any statement we have to send after, I'm assuming that's $1? Deb, those are great
For one
questions.
time, I think.
Or after one time? Okay. Yeah, so Deb, those are great questions. In Oregon specifically, there are no rules and regulations at a state level that you have to be compliant with. But like I mentioned, Visa does cap their surcharge at 3%. Even though MasterCard is currently at 4%, that's the cap that I would say that you would want to be able to implement, if that makes sense.
We can talk more about the second question as we get to the end. I think that's a really good one.
Yeah, I think so too. I think that, yeah, that'll weave right into Lauren's slide as well. Yep.
Perfect. Well, I'm going to launch the poll,
Okay.
and newbie here at poll creating. Apparently, I needed to make a poll for each question. So please just answer the first one, which is how many of you are currently surcharging today? Yes or no?
I don't see it popping up yet.
Yeah, I don't
Can
see
you
the poll pop up yet.
launch the poll again, Paula?
Yeah, hold on a second.
Sorry, guys, not in the chat. Yep, there's the poll.
Did it come up? Let me try it again. Saying
Oh.
share. But let me see if
I can relaunch it for you, Paula. Hang in there.
Okay.
There we go.
Thanks. All right.
There we are.
Woo, look at us go now. Looks like we're at 100% almost.
I think we've got, yeah, 56%. There we go, 70, 73. Great job, guys. Great job.
And people are answering the second one too.
Might as well. We'll come back to it. We were going to use that in a different slide, guys, but thank you for answering all of them.
All right. Well, let's end and share. So 4% said yes. We got one person and 25 with no. So We'll go back to the results on the other one when we get here a little later in the presentation.
Awesome. Awesome. Thank you, everybody, for doing that. And obviously, it's, that's probably one of the reasons why we're attending this webinar, right? I was anticipating to have a lot of folks that either said no versus saying yes, that they're currently surcharging. So that way we can educate you about this process. For those of you that are surcharging, I hope that this is beneficial and maybe can help answer any questions that you may have as you've been surcharging, and I'd love to hear your feedback at the end of this as well. So let's keep moving forward and discuss a few of the cons to surcharging credit cards. So for me, like Paula mentioned, I've been in the industry for 18 years. And what I realize about this industry, no matter what vertical you're talking about, whether it's healthcare, whether it's, restaurant, whether it's retail, whether it's e-commerce, brand awareness and brand image in the marketplace is probably one of the biggest things, right? So creating any sort of a negative perception with regards to your business, we all know we live in the day and age where Yelp reviews are huge, Google reviews are huge, right? We don't want to give that negative connotation to our business in any shape or fashion. And then that patient loyalty, right? We all want to be able to have repeat patrons and patients, no matter what business it is, because a retained client is just as important as a net new client. And what I worry with when we start surcharging or implementing a surcharging program is that patient loyalty could go down the street maybe to somebody else who isn't charging this for simply being able to try to pay their bill, right? We've touched base on the regulatory concerns. I would say, like I said, some of the certain states that have laws against surcharging, I've got this pulled up. So right now in 2025, the current states that it's illegal to surcharge would be Connecticut, Maine, Massachusetts, and California, effective July 1st of 2024. So California was a big one. A lot of people didn't realize that. But that got pushed through right at the end of July the end of June of 2024. And then when we dive a little bit deeper, right, Colorado does allow surcharging, but they're capped at 2%. So that's the state and local regulation, not a Visa, not a MasterCard. The state of Colorado is saying surcharges cannot be more than 2%. There's a few others, things like New York, New Jersey, Nevada, South Dakota. They prohibit surcharges that exceed the cost that the merchant pays. So now that becomes even more tricky, right? How are you calculating what your cost is? And if you're set up on flat rate pricing versus an interchange plus model, it's almost impossible to be able to try to figure out your exact cost on an interchange plus pricing model, because all those different card types that you're accepting have different interchange rates. So you would really have to be on a flat rate pricing model in those states to show we're not making any more margin or any more revenue by adding this surcharge for the convenience fee, right? Again, Kansas, Texas, Georgia, Minnesota, they all have their own individual laws. And like I said, I know we've got people from all over the country on here, but I would just highly encourage you to get out on the internet and start looking around at what those regulatory concerns could be. And then the last thing here would be the administrative burden. I think, Lauren has done a great job with her pillars of what's important in a practice. And I think that far too often, the people who are responsible for handling the billing, for handling the refunds, for handling that patient interaction, not just the docs themselves, are overlooked from what that administrative burden could look like. So like I said, it becomes ever more complex to be able to add a surcharging feature for things like refunds and processing payments that way.
Mike,
So
before we go to the next slide, a couple questions.
Okay, yeah.
That has to do with this slide, so I think it's important to address.
Yeah, we can stop. Yeah.
Yep, the first one, we use global merchants. They said they can set our credit card fee charge back through their system. So do we still need to contact Visa and MasterCard? Maybe they are doing this piece for their customers?
So some do. That's a great call out, Darren. So if you're utilizing Global, I know Global well. Global was formerly TSYS, so that's where I worked for about 7.5 years. Global is probably doing everything the right way. I don't want to, badmouth anybody here. But like I said, it's up to you guys as the merchant to make sure you are in compliance, right? So if they have registered you with Visa and MasterCard to be a true surcharging merchant, that's one program that's available. Now, if they set you up as a cash discounting merchant, that's a different animal in itself, right? With different rules, different regs, may or may not have had to register with Visa or MasterCard depending on where you're located. So that's a great question. I would just make sure you do your due diligence and follow back up with them to say, hey, just making sure we are compliant for offering this. And if there's any sort of documentation that you can provide me, please do so.
All right. So Jen also had a question. Please clarify, in Colorado, we can't surcharge more than 2%. Are they, or if they use a Visa or MasterCard, can we surcharge 3%?
See how this is already starting to get pretty complicated, right? That's a great question, Jen. So in the state of Colorado, no matter who you are as a merchant, if you're accepting credit cards, your surcharge cannot be above 2%. Visa's rules are 3%, but that is negated by the state rule of 2%. Hopefully that helps answer.
Deb had a question in here. As Zealous and Optum get our EOB files coming to us through them, if they can get their patients to accept their copies electronically, they also send an easy link to click on and pay their patient balance to us through them, making it sound like we are okay with them doing it. Patient pays the fee. They own the credit card processor who charges other fees. Then they try to send us a VCC to pay that patient balance, having us run it through merchant services, costing us money again. Oh, and since Zealous and Optum are banks who own the credit cards, they keep all of those fees. So I guess I think she's just calling out the situation and what your thoughts are on it.
Yeah, no, Deb, this is where I feel for you guys, right? In the healthcare industry, specifically with these virtual credit cards, this is what we're seeing a ton of, and passing it through and then making money on the back end. These providers have really figured out a way to skirt a lot of different things. So I think from my humble opinion, there's really not a ton that we can do about that. Unfortunately, it kind of is a situation where it is what it is right now. But I do know that from like I said, a CFPB standpoint, a lobbying standpoint, and how much grief Visa and MasterCard are getting in Congress right now, there's going to be changes, right? And that is something that I should benchmark this entire conversation with, is that all of these surcharging programs, cash discounting, all of these things could go away in an instant, right? If Visa says, hey, guess what, guys, we're done with all this. We want our interchange. We're upset with it. We don't need all this feedback the way that we're getting from, political headwinds. They could pull the plug, and they're the ones who are going to control that, right? So I wish I had a better answer for you, Deb, to be able to say that there was an easy way to mitigate that and not essentially be double dipped. But right now, there really isn't with those VCCs.
One last question before we go to the next slide.
Sure.
Darren was asking, does them signing the credit card receipt that has the fee on it, is that enough to satisfy regs?
Signing is obviously the biggest part. That's more of a chargeback scenario, not necessarily the rules and regulations for surcharging a merchant. But that does, if it clearly shows on the line item that there is a 3% surcharge being applied to that transaction, that does satisfy the rules and regs for that piece, as long as you're registered and you've done everything else the right way as well.
Perfect. All right.
Awesome. Great questions, guys. I love the interaction in this group. This is what we were hoping for. And this will fill up our hour quick. So thank you. So moving on, right? And I'll touch base on these ones quick because we've kind of already talked about it, but it's that negative perception and that patient loyalty. I just can't hammer that point home enough is, get the feedback from your patients if you currently do have one. And I'd love to be able to have any one-off conversations that anybody here in attendance would like to reach out, have a deeper conversation. I'm learning just as much as you guys are, right? So me being an expert in the industry, this is still a pretty gray space. And I'm trying to make sure that we optimize this and make everything as efficient as we can. But like I said, negative perception and that patient loyalty, those are two of the biggest things that I know surcharging could impact. The regulatory
Right.
concerns. Oh,
Sorry, one more
Yes.
question. Jen
Okay.
had her hand raised. Go ahead, Jen.
I'm so sorry about that, Mike. I was trying to catch it before you went to this next slide.
No
So
worries.
I'm still a little confused. So we are here in Colorado, this website, but maybe there's people in other states. I thought it was for the small business here in Colorado. So you keep saying 2% is the cap, but then you reference 3%. So
Yeah. So let me make that clear, right? Nationwide, Visa caps it at 3%. But since you are in the state of Colorado, the state of Colorado rule of capping at 2% would trump what Visa and MasterCard set as their limits. Does that make sense?
it does. So then basically you're saying if we're here in Colorado, we can only charge the max of 2%. So it doesn't matter what
Correct.
Visa and MasterCard and all these other,
Correct.
okay, to be compliant.
To be compliant, yes.
Okay, thank
With
you.
at a state level, correct.
Got it. And we're here in the States, so that's what matters. Thank
Yes,
you.
ma'am. Yep. Great question. And I'm sorry, guys, I can't see hands raised. I've got like 4 monitors, and I'm just
Okay.
focusing on this slide right here. So,
I got you.
okay. So we talked through the administrative burdens as well, right? So staff, training your staff. This is one question this is one thing that Lauren really opened my eyes to when we've had some different conversations, and I went through her pillars training as well. Training your staff on all the different procedures can be pretty cumbersome sometimes, and which I understand. But think about, how often you have overturn in your practice for anybody who's going to be at the front desk and handling these patient payments, right? That's a new person you're going to have to train and make sure that they follow these rules and regs. Because like I said, guys, you can go out and do some research. I don't have a ton of case studies pulled up, but there are plenty out there that show anywhere from $5,000 to $40,000 are fines that Visa and MasterCard can levy. And what most people don't realize is that they have secret shoppers out trying to be able to see who is. Because if you think about at the heart of what Visa and MasterCard are, they're a fee-based industry, right? We all have credit cards. We all have a debit card. We all have an interest rate associated with our credit cards. You as a merchant get to see the other side of the ecosystem where you're paying for those points and those rewards, right? So if you're out in the marketplace and you have a secret shopper and you're not following all these different compliance rules, especially specifically in your state, then they're going to be able to find a way to fee you, and at worst, be able to say you're no longer allowed to accept credit cards as a merchant, right? That's what we're trying to avoid with these complexities. So that's like I said, that's not just the administrative burden, that's more so the regulatory and compliance side. But, you know, reconciling for those folks on the back end, I would love to be able to hear feedback from anybody who said, yes, they're currently surcharging, how reconciliation goes, because are you truly accounting for that 3% when you do that? Is that throwing off your books because the deposits into your account are covering that cost, but have you allocated that cost correctly for your goods or services that are being sold, right? That's the reconciliation piece. So moving forward, I think we've got one other poll question here, right, Paula?
That is correct.
Okay.
So number 2 here, it looks like everybody already, let me share the results. Can you see that? How many of you have considered surcharging? Yes was 89% and no at 11%.
Yeah. Yeah. So it's obviously top of mind, right? It's something that you guys, you know, every industry, I don't care which one it is feeling compression, right? And when you feel compression, you're looking for opportunities to be able to reduce your costs in any way you possibly can. But I want you to think about this. Just let me plant this seed for you. Would you pass along your utility bills, your lights, your water, your lease, if you're renting a space, right? Those are all hard costs that you have. And I look at payment processing as a utility, right? You are trying to meet that patient where they are at to be able to accept a form of payment for your goods or services, right? And that's, like I said, that's my humble opinion. That's the way that I see this, is that we want to make sure that we're doing the right thing by that patient. And if they're willing to accept it, then it is the right thing. But if it isn't, and they're unhappy, then what are we doing from that patient experience, right? So great. I'm glad everybody's at least thinking about this. And then hopefully the third question we'll get to here shortly. I don't know, Paula, if the poll drops down, or sorry, what do I have to do? Just X out of it? Okay, there it goes. All right. So let's talk about best practices, even though we're not talking about surcharging, right? This could be anything that has to do with accepting card payments. So the number one best practice that I've learned, you know, by being in the healthcare industry as a merchant processor for so long, is any opportunity you have to be able to store that card on file to help manage those slow pay, no pay customers is a tremendous win. All you need to do from a compliance standpoint is simply get that customer's permission, have a form. We have templates. There's templates you could find online that are sufficient based on what Visa and MasterCard require. But when you get that card on file and you have it there, it really helps manage those slow pay, no pay guys, right? The second would be to negotiate your fees. If you haven't had an opportunity to, you know, shop this around to multiple processors, there's 3,500 merchant processors across the country, and I'm sure every single one of them would love to have a conversation, just like they call you guys 30 times a month, right? To be able to see whether or not you're interested in switching to their services. But I will tell you, one of the key times to be able to do your negotiation and to be vigilant on looking at your merchant processing statements would be in the month of April or the month of October. Those 2 months are the most important months because Visa, MasterCard, Discover, American Express, all 4 card brands have the ability to either raise their interchange rates or reduce their interchange rates. So I'm not sure how many folks have been in the industry, but back in, I want to say 2009, the Durbin Amendment took effect. And what that was is it brought debit card interchange rates all the way from like 0.95% and 15 cents a transaction down to 0.05% and 22 cents per transaction if that debit card was issued by a regulated bank, right? A regulated bank means that it was issued by someone with more than 10 billion in assets. So think of your big guys, your Bank of Americas, your Wells Fargo, your Chase, your Fifth Third. those financial institutions, right, that have that many assets, that's what those debit cards should be qualifying at from an interchange rate, which is huge. That's obviously a 90 basis point savings, and that helped a ton for the actual cost associated with processing payments. And then the third thing that I want to touch base on is exploring alternative payment methods. This is another thing where we're trying to future-proof businesses, right? So if you've got terminals or you're using an integrated solution with your practice management software, if you do not have the capability to be able to accept Google Pay or Apple Pay through those devices and those terminals that you have existing, I would highly encourage you to seek out what it would look like with your existing processor and or someone else for accepting those payment methods. We're starting to see a lot of people move into a digital wallet, and that's a trend that I don't see going away because nobody wants to carry cash. And if they don't even have to carry their card, all they have to have on them is their phone instead of a purse or a wallet. Think about how impactful that is where you have the opportunity to capture that kind of a payment. So I highly encourage everybody to look at that as well. Moving forward, I really wanted to get into how I can help you guys negotiate these merchant fee schedules, right? So comparing your rates by calling up another merchant processor, seeing what's available, you see where you're at today, and they'll do an apples to apples cost comparison, much like we do, to be able to see how much opportunity there is for savings. And sometimes this can be quite substantial. One of the verticals that we work a lot in is an optometry. And there's a 3-location optometrist that I was able to save close to $41,000 a year, just simply because they've never looked at their merchant processing fees, right? They've been in business for 10 years. And every single year, their existing merchant processor kept raising their actual rates, even though Visa and MasterCard's rates didn't raise that much. So it's being able to identify what's truly cost and what's truly markup from your existing merchant processor, right? So comparing those rates is crucial. If you're a multi-location practice or you have multiple means to be able to accept payments, things like an online patient portal, text to pay, if you're utilizing a system like Weave, the more that you can do to get the volume and bundle those services together, the better off you're going to be. Because if you can use one single merchant processor for all of those, it makes reconciliation easier. It helps reduce your costs because you should be getting volume discounts. And then it just, like I said, makes life easier because it's one single point of contact if anything should go awry from a deposit standpoint. The annual reassessments, we talked about that. April, I was a little early. We talked about that April and October. And then, understanding your terms of your agreement. This slide, I have so many third-party stories because I've been doing this for so long. When I say understand your terms, you may have an agreement with a merchant processing company, but if you are leasing your equipment, and that's the key word, lease, that would be through a third party. And that lease of that equipment, even if you cancel with your existing merchant processor, will live on because it's a completely separate agreement. And I've seen merchants that have gotten dinged almost close to $4,800 to $6,500 over the course of the 3-year period that they signed for that lease to break it and move on because they were paying almost $300 to $400 a month for their equipment. That's just highway robbery, guys. That's not the way that it should be. But unfortunately, that is a black eye in the industry. So I'll pause there. I don't know if anybody, Paula, I can't see chat-wise. We're good. Okay. We'll move forward here. So then again, exploring those alternative payment methods. I think one thing COVID taught us, all of us, is that we can be fast and flexible and nimble and really meet our patients where they want to pay, right? So mobile payments, and like I said, Apple Pay and Google Pay, having that acceptance capability is huge. offering payment plans, right? It doesn't necessarily have to be a financed option. It can be an own in-house internal payment plan where you're setting someone up on a recurring billing structure because you have the feature functionality to do that within the payment gateway that you're processing payments through. Text to pay. This is a cool one. If you haven't implemented this already, guys, I would totally go look at this. We have an optometrist again who saw almost a 15 to 20% increase in her slow pay, no pay capture rates once they started implementing text to pay. And what that is it's simply a program where you're able to get the patient's phone number, you understand what their invoice amount is, and instead of having them, receive a paper bill in the mail, you send out this text message, and we all know everybody's reading a text, right? So when they get that text message, there will be a hyperlink in there that they simply click on, and it's redirected to a hosted payment page to accept that payment. That's huge. And then the auto debit options, right? That's another alternative to look at as well. And then, like I said, future trends in medical payment. I keep hammering home text to pay in these digital wallets. That's really what I see as a future trend here in the healthcare space. It's just making your guys' lives that much easier to collect that payment, right? I won't spend too much on this slide. It's kind of redundant, but I like the image, so I threw it in there. But in conclusion, right, as we go through and we weigh these pros and cons, like I said, I can see the pros, but I just feel like the cons outweigh most of the pros for trying to implement a surcharging program. That being said, I have merchants that I've set up on surcharging and we do it the right way. But if I can talk to them and say, hey, listen, maybe let's talk through this a little bit more, weighing these pros and cons like we're doing today, I'd say almost 7 out of 10 times, anybody who's thought about it kind of gets deterred from it after they have a conversation with me and we explore all these different things that could be impactful, right? So obviously financial recovery and cash flow benefits, those were the pros. And our cons, regulatory and compliance, how is our patient going to react? What are the administrative burdens? And then how are we putting ourselves at competitive risk to be able to say, there may be another practice down the road that's not doing something like this, that our patient who's been with us for 15 years could have one trigger point where they say, nope, I don't want to pay it. I don't want to do that. And I want to get all my points back on my card, and it's my card, and I should get those points back, right? So those are all things that I really just wanted everybody to have food for thought for. But this is the conclusion of my portion. And then Paula, I think we've got Lauren up next.
Yep. Thank you, Mike, for
Yeah.
all the wonderful information.
You bet.
Lauren, take it away.
Okay. Well, I don't know about everybody else, but when Mike and I first sat down to talk about this, I was overwhelmed. And I thought, this is scary. Like, we're stepping into land here that just feels really uncomfortable. So if you choose to not go down that path, what can you do from some financial management best practices? And I knew that I only had a few minutes, so I kind of picked my top 5 today. But one of the main things that people ask about is, can I offer a same-day discount for prompt pay for self-pay patients especially? And yes, you can. And many practices do. And in fact, I have conversations with groups all the time about what that percentage should look like. And we could talk a lot about that philosophy, whether it should match maybe your lowest payer, Medicaid, Medicare. That's a little bit groundbreaking to say out loud, because I'm guessing many of you don't go that far on your discount, but you could. So yes, you can do same day discounts. And the other thing is to really look at your billing and coding processes, and how recently was all of your coding audit done? So you should be doing this annually, folks. Somebody needs to be looking at how your providers are coding, how you're getting paid. Are you billing your telehealth things appropriately? We had a conversation locally in Portland about this, about how all the payers are changing their telehealth rules. Do you know what those rules are? Does your billing office know? And are you managing that effectively? And then I also just want to talk about improving your collections processes. So making sure that your front desk staff is comfortable saying, how would you like to pay today? Not, are you going to pay today? Right? There's a big difference in that conversation. And also, I see you have a previous balance. How would you like to take care of that? Giving people the scripts they need to feel comfortable asking for money is huge. A lot of times we don't do a great job of training the folks that are at that front line. So giving them what they need to be comfortable asking for money and to know exactly what they're asking for and why they need to do it. And then I want to talk just for a second about negotiating with your payers. So people tell me all the time, but I have a small practice, or the payers won't talk to me, or there's no point in doing that. And I will give you all kinds of statistics that prove that wrong. You can absolutely go back and ask for a raise. Will you always get it? Not always, but sometimes you'll be surprised. So making sure that you're doing that annually and making sure that you're adjusting your fee schedule. So recently I worked with a group who was charging below what the payer would allow. And folks, if you don't know this, the payer is going to pay you the lesser amount. They're not going to pay you according to the fee schedule if you're not charging them high enough to reach the fee schedule. So the first thing we had to fix was getting their fee schedule up to market rate. And then we went after getting an increase from the payers. And then the other thing that I'm hearing a lot too is that we have some no-show problems, and this has really not gone away. And in some specialties since COVID, we had patients who kind of stopped coming in. They'd make appointments, but they wouldn't show up. And those are huge lost revenue opportunities. So what can you do in your individual practice to reduce those no-show rates and make sure that every slot is filled every day? Do you think about implementing a proactive tool where it says, we have a cancellation this afternoon. Would you like to come in and fill it? There's some really cool tech out there that's now doing that and doing outreach to patients so we can fill in those gaps. And then, Mike, I took one note that we just didn't talk about, which was avoiding PCI non-compliance fees. If you're not looking at your merchant processing statement every single month to balance it, and also making sure that you're not getting hit with a PCI non-compliance fee, that stuff adds up. So I was just thinking about a practice I worked with where I was seeing that happen, and it's an easy fix in most cases. So do you see that in the groups you work with too, Mike, where people are getting hit with these hidden fees and they don't even realize?
100%. And we should have made that a poll question, because I'm sure there's most of the folks that are on here. Hey, do you hate PCI compliance? Right? Raise your hand,
100%
yes
yes.
or no. Right. So no, it's definitely something that you're spot on, Lauren. You have to pay attention to your statements, because there are other fees that could be implemented even outside of PCI compliance, right? I had a merchant who was with, I won't name the merchant processor, but they were with them for a number of years. And up until like the most recent last 6 months, they had never seen this fee on it on their statements. But then they started to see it and they were like, what is this for? It was another $125 a month to be able to have digital analytics for what other merchants who are in their MCC code are seeing. So that way it's like, you can understand what your competition is seeing for volumes and kind of a benchmarking tool. But they never signed up for it. They never asked for it. They never wanted this service, right? So it was just something that was implemented. And that was, the quickest way that I was able to show them $1,200 a year in savings, right?
Wow. Yeah, that's material for sure.
Yeah.
Yes.
All right, that's my 2 cents, everyone. And if you have questions on how to do any of these pieces, I'm here to help as well.
Wonderful. I know we have our last poll.
Here we go. I'm going to relaunch it.
If we relaunch, because this one, guys, was supposed to be at the end, right? Oh, okay. So this
There
is
it
still
is.
unanswered. Okay, cool.
Yep. Following today's session, what is your likelihood of moving forward with surcharging? 0 to 10. Give it a few more seconds here. All right. Ending and sharing. So as we can tell, majority are 5 or below. We do have one at number 10. Curious if that's the same person that Yes is.
Probably still, yeah. No, that's okay. That's okay. This is why we wanted to do this, guys, right? So it's really thought-provoking stuff. And thank you all for your feedback because this helps us, right? Be able to develop a narrative and to make sure that we get you guys the information. The credit card processing industry, I hate to say it, is still a bit of the Wild West. Regulations are really mandated by Visa and MasterCard, but now that surcharging is starting to be handled at a state and local level, we're really starting to see that pushback because states don't want to hear these complaints. The CFPB doesn't want to try to handle this stuff. They should be looking at deeper issues than this, right? So like I said, if there's anything that we can do to help educate you and help give you the right tools to empower you, that's our job. That's our goal.
So we do have already another question in the chat.
Awesome.
If we are saving the card that the patient is swiping, do we still need a consent form, or is this only for manual entries by our staff?
Okay. Well, I gotta see. I gotta laugh. J4, we call that the Tuesday special. So slippery. I love it. Yes, yes. And yes, I hate PCI compliance, and they will not remind you that you have not done it. Jen, I appreciate that statement 100%. I will tell you, every merchant that I have, I call 30 days beforehand to make sure that they become compliant. That is one thing that we do from a white glove standpoint. So yes, you're right. Most merchant processors won't because it's a way to generate revenue. But I think that that's cheap, dirty money, and I don't want that money. I want to be honest and ethical, right? So let's go back to Kalia's question. Apologies if I butchered that. If we're saving the card that the patient is swiping, do we still need a consent form, or is this only for manual entries by our staff? So that's a great question. If you're going to keep the card on file at all, you just need to have their consent one time, right? And then typically, what I would encourage you, right, is everybody's got a different practice here. So kind of understand what your average transaction volume is. And I would say double it or 3x it and get that permission to go up to that dollar amount threshold from the client or from the patient, right? That's just good rule of thumb. And then that way you're covered. It's all CYB is what I call it. Cover your butts, right? You gotta make sure you have that documentation.
We did have a chat just to me, Mike. Have you ever had a client you worked with experience fines or fees?
Yes. So I haven't personally, but like I said, we've seen this in the industry, and it can happen. And I think I mentioned it during the presentation. It can range, right? Anywhere between probably 5,000 to 40,000, depending on how far out of compliance you are from a surcharging standpoint. It's really up to Visa to levy those fines and fees, all up to them, nobody else. Great question.
It looks like Kalia. Hopefully I got that right too. Is there a specific form that you recommend?
So what I can do is I try to be able to give you guys a couple different options that are out there. But it's customizable, right? All you really need to cover in the form is that you've got the patient's name, you've got the amount, right, that you're going to go up to, and then you have their signature, right? That's really the biggest thing. And then keeping that on file with whatever practice management software you have, where if you can scan it in and upload it to that patient record, that's how I would do it. But it's a great follow-up, Paula, if you wouldn't mind capturing that, and then I'll try to be able to send everybody out who is in attendance today some templates.
Perfect. I know we have 4 minutes left and we want to be respectful of everybody's time. I know there was another one in the chat. If somebody doesn't have one that they want to ask real quick before our 4 minutes are up. If not, how do you know that interchange rates have changed?
So yeah, this is really, really powerful stuff, right? But Google is your best friend, obviously. You can simply go out to Visa's website, and these are published rates, right? And since you're in the healthcare industry, there's some other things that we didn't touch on, like EMV. So the way that you accept a card can also help qualify to a better interchange rate. If the card is not present, then there's a higher risk for fraud. If we're not getting all that information, like the CVV code, the 3-digit code on the back, the expiration date, the zip code, gathering even the address, the numbers in the address is huge to be able to help qualify that card not present transaction. But even a card present transaction, I'm sure you've noticed all on your cards, you can see those little 3 dashes that look like a Wi-Fi signal. That just means that card is tap capable. And if you have tap to pay on your devices, that's the number one order that I would do that in, right? So it goes tap, it would go insert, and then swipe for qualifying those interchange rates. But simply go out to Visa's website and take a look and start to understand it. And if you have questions, we're at the 2-minute mark, so I'll throw up our contact information. Be happy to help guide you guys through that process.
And we have one more question from Trevor. If we charge a flat fee for, say, mailing statements, for example, is this subject to the same surcharge rules, 2% here in Colorado? I assume not, since it's more of a line item charge, but want to confirm.
Okay, I want to make sure I understand this. If we charge a flat fee for say mailing statements, are you asking, Trevor, and feel free to come off mute if we can unmute him. Is this subject to the same? So you could not go above 2%. Yes. I mean, even if you're mailing an invoice and surcharging in the state of Colorado, it still is capped at that 2%.
Yeah, I think that's, kind of the root of my question is, our vendor is now passing along a $1 per page fee for mailing statements.
Oh, wow.
We are looking at ways that we can recoup that cost as adding a line item. Do we want to steer clear of calling it any sort of surcharge by name to steer around that 2% rule here in Colorado?
Well, so that 2% rule is just going to apply to the credit card payment. So if you're talking about, you want to add a fee for, sending out paper billing, I would say, that's completely different. I don't know what, I guess I shouldn't say, feel free willy-nilly, but it's probably okay, I would imagine, if you're going to do that, because that's more of an incentive to maybe say sign up for electronic statements. Is that kind of where you're going with that?
Yeah, for sure. And like I said, I see it as a separate issue than credit card percentage surcharging, but I just wanted to make sure, if we send a bill for 50 cents and we charge them $1, and that would fall into this 2% rule because it's obviously more.
That's a great question. The 2% rule specifically is applied to the surcharging. I'm not sure about any other convenience fees or a shipping and handling fee or a incentive fee for other things. But that's a great question.
Cool. Thanks, Mike. Go Big Red.
Yeah, you bet. Yes. Go Big Red, he said. Go Big Red. Let's go. In Colorado, Trevor.
I'm deep in enemy territory here.
Me too, Trevor. Me too.
Oh, I love it.
Mike, can I catch you one time before we hang up really quick? Because I think the few people who are left might want to know this. So I'm training Susie at the front desk. She's presented with a credit card.
Yep.
What is the best way for us to save money? You said it briefly, but I want you to slow down. Yep. Hand me the credit card. What do I do?
So if your terminal or your device allows for tap to pay, it would go tap, insert, or swipe.
Got it, everybody? Just by knowing that, you can save significant money. So encouraging your patients to tap when they can will cost your practice less. That's an
Correct.
important detail.
Up to 10 basis points for that transaction. So when you think about that
Oh,
over the course of however many transactions you
yeah,
process, it's pretty substantial.
it can add up. Jen says, I would love it if the HSA cards had a chip or tap to pay. Yeah, mine has a
Jen,
chip, but no tap to pay. So I hear you.
you're right. You're absolutely right. And I think that could potentially be coming down the pipe, Jen. So yeah. Yeah, just keep an eye out for it.
Thanks for clarifying that, Mike. I like the
Yeah.
practical stuff. What do we need to take away today?
Yep,
Yeah.
absolutely.
And big thank you to Mike and Lauren. And we appreciate everyone joining us today. Hopefully you each took away something, especially this last item, how you save money, best way to take that credit card. And definitely keep a lookout for the next webinar that Arbor Bank will host. So thank you all and have a great day.
Thank you, everyone.
Take care, everybody.